Hi, we are part of the Multiple Sclerosis Rehabilitation Treatment Team at the Johns Hopkins University School of Medicine. I'm Dr. Abbey Hughes. I'm an assistant professor in the Department of Physical Medicine and Rehabilitation, the Division for Rehabilitation Psychology and Neuropsychology, and I'm a rehabilitation psychologist.
And I'm Dr. Alex Sandoval, clinical associate and MS rehab specialist here at Johns Hopkins. The Johns Hopkins Multiple Sclerosis Center is a leading center in the nation for MS treatments, research, and education. Here we practice a multidisciplinary, team-based approach to the overall management of MS. We have close collaboration among various subspecialties, including neurology, physical medicine, psychology, and rehabilitation therapies. We know that MS affects each person differently, therefore we personalize our treatment approach to each patient depending on his or her specific needs.
The concept of rehabilitation is really important for patients with MS because in addition to their disease-modifying therapies, which is typically managed by neurology, rehabilitation focuses on symptom management and reducing the negative impact of symptoms on quality of life. So with physical medicine physicians, psychologists, and the rehab therapists, we're able to help patients manage those symptoms and improve their quality of life.
The physical medicine and rehab approach to the management of MS is a multidisciplinary team-based approach. Our team consists of rehab physicians, psychologists, and rehabilitation therapists, which include physical, occupational, and speech therapists. Now, the rehab physician is the one overall in charge who directs and coordinates the team. And he or she can also provide symptom management through, by addressing problems of pain, spasticity, fatigue, as well as addressing issues with problems with bowel and bladder. The physical therapist will provide exercises to help improve strength, coordination, balance, and conditioning. And they will also train the patient on the use of gait devices such as canes, crutches, walkers, and also braces. The occupational therapist would provide exercises to help improve upper extremity function, especially hand function. They also help retrain the patient on the performance of his or her activities of daily living. They will also instruct the patient on the use of adaptive equipment and devices. The speech therapists are involved in the treatment of impairments related to speaking, swallowing, and also cognition. And we also have the rehab psychologists.
During their first appointment, individuals with MS can typically expect to meet with their provider, whether that's the physical medicine physician or the psychologist or the physical therapist, etc. It's usually a clinical interview to start, and we like to get a comprehensive history of background, including things like past medical history, education, where you worked, other activities that may be relevant to your rehabilitation, how you're doing currently. That includes things like your sleep, your appetite, your pain. We really want to get a comprehensive picture of how things are going currently. And then there's also usually some assessment that occurs. Within rehabilitation psychology, we may do some brief cognitive assessment or some brief screeners, such as some surveys to fill out questionnaires about mood, appetite, pain, those sorts of things. Sleep is another issue that we typically ask about. And then we may recommend patients to continue with more formal cognitive testing if necessary. They can sometimes complete that directly after their appointment with us, or they can come back at another date, particularly if they're feeling fatigued. And we understand that fatigue is one of the most common symptoms among people with MS, so we want to be sure that we're addressing that. That's the typical layout for most appointments when patients come, is there's that initial assessment piece, and then there's also treatment. With rehabilitation psychology, after that first treatment, we also offer interventions. So patients can follow up with a rehabilitation psychologist to do things like cognitive behavioral therapy, acceptance and commitment therapy, to address those symptoms, to treat depression, to treat mood, to treat pain, to treat sleep disturbance. All of those things are included in the intervention, which may be several appointments after that initial session. Johns Hopkins has a novel and groundbreaking approach to treating MS through the Precision Medicine Center for treatment of multiple sclerosis. It's a center for excellence where we tailor treatments to meet the individual needs of patients. So precision medicine means personalized care or individualized care to the patient. From a neurology perspective, and within the neurology department, that typically means following MRI, DNA, and OCT imaging data over time, in addition to lab tests as well, so getting some of these physical markers of disease progression. And then with rehabilitation, we also follow patients to determine what kind of symptoms they're experiencing individually and how we can tailor our interventions to meet their needs. So that includes what Dr. Sandoval has already discussed in terms of the physical rehabilitation needs, as well as rehabilitation psychology interventions. One of our main goals is, again, to reduce the negative impact of disability on quality of life and to help restore function. And so that's where our two departments are very collaborative in that way.